A lot of times patients come into the office already having experienced a lot of medical trauma where they've not been believed by their practitioner. They've been told that it's just in their head, that there's no way they could have this many things wrong with them looking as healthy as they do, that you're fine, you're healthy, you just need to accept that you're okay. Um, when their body's telling them something completely different, they're hurting, things aren't working right, they're trying to help themselves or they're trying to do their even prescribed physical therapy and it's making them feel worse. And so when they come to my office, they're oftentimes afraid that it's going to be just another experience. So I always feel honored that they're willing to tell me what's even going on after the bad experiences they've had. Oftentimes I'm the fifth therapist, so they could trust that someone might have the answer, and like that's a lot of hope right there. Um, yeah, so I don't want to disappoint those patients when they come in. And so it is a collaborative teamwork process too. Patients don't always respond to the same technique the same way. Um, and so I need a patient to tell me if something's not working, and then we can try to modify and adjust to whatever their needs are, whether it be positioning requirements or it could even be just a feeling. Like I had a patient, we had her back to the wall to give feedback to her shoulder. And I wanted her to be able to feel where it was. And she just said, we need to stop. I feel like my back's up against a wall. And I'm like, well, it is. It literally is. But if that's making you feel cornered or like you can't move the way you need to move, we don't need to do it that way. So we completely switched and used a visualization technique where she imagined holding a ball in her hand and stretching the ball to be bigger while she was moving her shoulder, and got a visual cue instead of a tactile cue for her. So it can be something as simple as that that's going to create success for the patient. And I always appreciate that the patient's willing to give me the feedback so that I can modify to what their needs are.